right, so we might as well get started. It's noon. I am joining you all for my lunch break. So we are going to be tight to time. And thank you, Phil, for sending out an additional version. I had attempted to save it in a compatible version and didn't quite make it all the way. So today we are going to hopefully run through the edits to date so that we can finalize a version to present to the rest of the board. Does that work? So we have two parts. We have the narrative of the plan, and we have the continuation of services chart.
Vanessa, can I just ask for, is it possible for someone to send me the draft that you're working off of? Because I don't think I received that because I'm not on the committee.
Sure. Tim, are you able to forward that? Is there anybody else who needs it?
I think
Is this the one you sent last night?
Yes.
I can do that. Hang on, and it'll be about a minute or so, folks, and I'll get that going.
Thank you.
Yep.
Okay. And I'm sort of straddling two devices here, so just give me 1 second. Okay, so just a little bit of a recap because it's been a little bit of time since we met. We talked about a variety of things that I think could support this pandemic operations plan being more usable to the library staff and more flexible so that it can sort of remain in place with little activity from us. I think the overall goal is to sort of get a workable plan out there and leave the library and the team to conduct their business. One of the suggestions that was made to help do that was to infuse in this plan language that refers to sort of the current CDC or local health department guidance, so that wouldn't require us to constantly come back and update this. Thought that was a great suggestion. Additionally, I tried to infuse in here language that I think is actually pretty clear at the beginning, that really empowers and gives the discretion to the library director to implement the plan and make changes that are needed. A couple of things that I plan to include when we present this to the whole board is really some reminders. This is a plan. It's not a policy. And basically the plan is meant to offer some guidance for the library staff to manage library functions, which we all know is the prerogative of the library team and not the responsibility of the board. And so I think that it'll be important because we've kind of gotten bogged down into the details at times. All of us, myself included, are guilty of this, really sort of crossing the boundaries into some management decisions and issues that are really meant for the library to determine and not us as board members. So our role really was to meet the state requirement and ensure that a plan was developed and submitted, which had been done. And now knowing more, living through the pandemic all this time, that we can anticipate changes in understanding and knowledge, we can have that reflected in the plan so that we really have a plan that's usable as things sort of evolve and change. Any questions about that before I sort of walk through some of the changes that I attempted to make that I hope reflect what our discussions have been so far? No, we're good with that? All right, so really nothing in the first part of the page 3, I guess, of the plan that Tim will eventually sign once we finalize this. It's kind of boilerplate language. I wasn't here when this was first developed. It seems standard, so I didn't make any changes there. I will say that with versioning and sort of that, just a general statement at the beginning, Tim, if there's someone on your team that can kind of go through and once we've decided on the content, just make sort of stylistic or format changes. I couldn't edit this table at the beginning. We probably need a new note that documents this additional revision.
What table, where does that table?
It's on page 4. I mean, and it's a table in the loosest sense. It just has date of change, description.
Oh, record of
change,
changes, sure.
implemented by.
Yep,
I did not update that yet.
we can do that. And any other, you know, edits that need to be done, so.
The page 2, once we get through with this, the page numbers have to reflect the content. So I have little comments like that, but I'm sure you'll go through it and fix them all. But that's an obvious one.
Yep, thanks.
Yeah, I tried to update some, but I did not do
Yeah.
a page by page check. So
Well, once it's
once
finished,
it's in the
that'll
final
be
form.
easy to do.
Yep, thank you though. That's a good reminder. And additionally, I think too, where I could use some help is just consistency of language. I did notice sometimes we refer explicitly to Albany County Health Department. I think my default language, just probably because of my own background and use, I refer to it as local health department. We should probably be consistent. They mean the same thing, but for just purposes of a clear document. Okay, so I think a couple of important things to also notice is that this plan is really in response to the outbreak of COVID-19. So although it's called a pandemic operations plan, it is actually a COVID-19 pandemic operations plan. And that's just a note for us to keep in mind if there were to be some other pandemic, which I even hate to say out loud. It acknowledges some of the history, the scope, no changes really there. It does reference CDC guidance for keeping workplaces, schools, homes, and commercial establishments safe. I believe that this is a archived link now because the guidance, some of the guidance has changed. And so I don't know, I wanted to ask the committee what they thought about that. It's still accessible. And I think that there's still good tips in there. I didn't have a replacement for it, so I didn't want to delete it.
Vanessa, just a question. I have minor changes in language that I don't think we need to discuss. Who should I call after the meeting or at some point in time just to give you my suggestions? They're minor, and I don't think we need to take the time here.
You can send them to me. I think the
Okay.
best way to do that, or actually,
Okay.
Tim, do you know who would be formatting the final version?
Well, it'll be Jenna.
Okay,
Okay.
So
thanks. Okay,
one thing, actually, Marcia, if you're okay with it, if we can get it in I would rather have your eyes on the version that is sort of paginated and formatted, because we'll need another look at it. And then maybe what we can do is track changes.
okay.
I'm not going to haggle over little words. I'm actually fine to include anything that you suggest, but I want to leave that open so that it's transparent and folks know what's been changed.
Yeah, I'll call Jenna and ask her to do track changes.
Okay.
Okay.
I would keep that CDC link there, just
Me too.
because you say there's good information still there.
Okay.
Yeah.
And these are all.
I just looked at it and it was good.
Oh, it's still an active link?
Yes, it is.
Not archived. It didn't have an archive
No,
at
it's
the top.
called What Every American and Community Can Do Now. So,
So the
it's
name
still there.
changed.
mhm.
Okay. I knew it was something was different. There might have been a different link that was archived. And so the only other thing here is I want to highlight that these are these are guidelines that they encourage all employees. So I think that that keeps us in sort of the safe zone of not boxing us into practices. Let's see. Okay. Planning assumptions. Boilerplate, I didn't make any changes. Okay, so I think some of the changes started to come into around the implementation of the plan. So we have the language at the beginning that the library, the director, designee, or successor, they hold the authority to execute and direct implementation of this plan. Implementation, monitoring of operations, and adjustment to plan implementation may be supported by additional personnel at the discretion of the director. I'm trying to just find this. Sorry, my track changes are not showing up on my device right now, so I'm relying on my memory some.
For me, that's on page 6, the implementation of the plan.
Yep.
Right.
So then there's some weird formatting things that have to be corrected there. The top of 7, the director, his designee, or his or her successor will maintain awareness of information, direction, and guidance from public health officials in the governor's office, directing the implementation of changes and adjustments to pandemic operations as necessary. So I strengthened the language there just to widen it. It had primarily been focused on the governor's office as it related to, you know, we got a lot of things initially through executive order. And now most of the guidance that this plan relies on is more public health. And so I think that is subject to change if conditions were to worsen and we were to enter into a state of emergency and there were more EOs. We would want to make sure that the director used that to sort of adjust operations at the library accordingly without requiring revision to this plan. And so do folks find that as an acceptable adjustment and inclusion? I basically just put you in the hot seat, Tim. You already do it anyway. You're reading all of the announcements that come out, and you'll make smart, fair decisions about how any operations might have to shift upon the knowledge of new information or EO.
I'm fine with that. I would like to publicly thank Maria and Phil, who are part of that team, and really the rest of the department heads as well. And many staff members who are not tasked with this will just forward articles and links and things like that. So it's a library. We're about information, you know, so.
Okay. The next section is about mission essential functions. It goes to create sort of a hierarchy. No significant changes were made to this. I don't think I've heard any discussion or disagreement about how functions were prioritized. I think the only adjustment that I made in this section was once we get lower into, where did it go? It might be later. The succession plan, that might be later. Okay. When we get to reducing risk through remote work and staggered shifts, I think that this was all fine. I'm assuming that the telecommuting policy for employees exists elsewhere outside of this plan, so we didn't have to worry about that, just incorporates it by reference. Personal protective equipment. I did remove face shields and gloves from here. That's no longer a practice that's being widely advertised. I didn't want to perpetuate it. There's no reason for the library to be responsible for providing something that actually the CDC doesn't recommend. Masking and hand sanitizing remain. Any questions or discussion about that change?
Just that we do have about 60 face masks on hand if anybody needs one. So some people are more cautious than others, and why not use them if they're available? But I understand removing it from the plan if
You
it's,
mean the face shields?
yeah, that's what I must have said masks, but
Oh, that's okay. As long as the understanding is that they're still required to wear a mask beneath it.
mhm. Yep.
Okay. All right. So the staff exposure section, cleaning and disinfection, does have a variety of changes in it. I sort of elevated that the library would coordinate with local authorities to complete contact tracing and implement current quarantine and isolation protocols, because again, that is an area that we've seen shift over time. And I also indicated that this next sort of detailed practice or protocol is at the time of the update. The reason I did that is that I actually think this segment, it's important to have some details present here because they are pretty specific and exposure is probably the biggest risk in our setting. So it by and far stayed in two groups. I also left in contractors. I know that there was some discussion about that before, but we still have contractors accessing the building. It doesn't hurt to include them.
We really
Um,
always will.
Okay.
We're not under constant renovation, but there's always, maintenance going on. That's where we hire a company to come in and clean an air filter or whatever. So,
Um,
I have a question. We
Sure.
refer, and we have referred consistently to non-vaccinated and vaccinated, and then testing. We don't differentiate between rapid and irregular testing. I don't know what the local guidelines are, but would rapid testing apply here? I don't know the answer. I'm just asking because there's a difference between, the test you get back in 15, 20 minutes or whatever, and the 3 or 4 day test.
Absolutely.
We don't
Did actually,
differentiate.
go ahead, I'm sorry.
No, that's it. So
I
I
was
don't know
gonna
the answer
say
to the
that
question.
we can clean it up. I agree with you. I did specify specifically around isolation that, hold on, let me just find it. It's a long section. A viral test, a positive viral test as it related to what sort of triggers a
Right.
isolation. But
Uh-huh.
I agree with you that that could be tightened up. So my understanding of it, and one thing that I wanted to recommend at the end of this was maybe a look over by, I don't know, Tim, does the library have someone at the county health department that you all work with? They
if
should
it's,
be partners. I mean, they could give it a once over and say if it,
so the county really is not very responsive, but the town of Guilderland has a physician and an EMS department who are both very happy to help with that. So if it's acceptable, I'll ask Don Doynow, the town physician, to review it.
and I mean, I think that's okay, but I do think given that we're sort of the quarantine and isolation procedures are dictated by the health department. If they are up to date with those requirements, then I think that's fine. Or maybe they have a relationship with the health department
do.
that we could leverage.
They do, and without editorializing, the county just isn't playing that role. They are not, looking at people's plans and suggesting changes. So it's
Okay.
really hard to get a hold of anyone at the county.
Okay. That's fair, but that's a good point, Marcia. My understanding that it needs to be like a diagnostic PCR test is
Mhm.
typically what we're
Yeah.
talking about. At least for right now. I have heard, and so again, we're in this, we may want to word it in a way that doesn't box us in. because there have been a lot of reports of an improved functioning of those rapid at-home tests.
So
not to state there are some challenges with some of the other tests, and it remains unknown. They're looking into their ability to identify the Omicron variant. So
it's a moving target, but I just raise it because I don't know the answer, and I didn't know what the group thought about it. So,
but it's a good question, because from my perspective, I hope that we end with a plan that allows Tim to make those sort of procedural adjustments about what type of test it is, without us having to reconvene around this.
Yeah.
Okay.
Great.
So just broadly, there are kind of two groups as far as exposures: employees or contractors who are exposed to a known case. And so in that case, if they have no symptoms, sort of the process of what they need to do, kind of outlined here, meaning that I think I updated this because now it's the lesser of 7 days if they've received a negative test, or on which has to be done on day 5 or later, and 10 days if they have not had a test. Okay. All of these include notification to the supervisor. And then I added in here, because this had changed, for those whose full vaccination has been verified. And so this is sort of an interesting scenario. Employees, as I understand it, are not required to verify their vaccination status. However, if they would like to not be subjected to quarantine after being a close contact, that's why the wording is around full vaccination has been verified, and not just that someone says that they're fully vaccinated. There's no requirement to verify that. And so you're still free to keep that information private. However, you're back in that earlier group that has to quarantine for 7 to 10 days. If your vaccination has been verified, what I didn't include in here is I don't know who it's appropriate to have that verification done with. I would assume that it would be an HR person if we had one. So it might just be the library director. I wanted to ask that question. So if an employer or contractor verifies their full vaccination, that's 14 days past the last dose. The definition does not yet include boosters, so we don't have any mention of that in here. 10, then they can return to work if they are symptom-free and have received a negative test.
Works for me.
I just have a question on, well, it's page 12B. The heading is, if an employee or contractor exhibits symptoms of the communicable disease that is the subject of the public health emergency. First of all, we do use the term full vaccination. So that may mean boosters. I don't know.
No, currently the state definition does not include boosters.
It's just the 2?
Yes.
Okay, thanks.
And I actually think it's wise to leave it worded as full vaccination, because we're covered if they do include booster.
No, I agree. I just didn't know whether or not it did include boosters. But in B5, administration must be informed in these circumstances, referring to B, and who is responsible for ensuring these protocols are followed. Who is the who? Somebody on your staff?
I think the word who should be removed. Administration is responsible for ensuring these protocols are followed.
Yeah, that's what
I actually had suggested that revision in an earlier plan, but as has been noted, these plans ping around several different email addresses, and so
it's fine. Yep.
Yeah. Okay. So when I talk to Jenna, I'll just mention that to her as well. Okay.
So what I'm doing is I'm making some of these adjustments that we're talking right now, so I can recirculate that, so she won't have to refine them if that's
Cool.
okay.
Okay, because I'm not bothering you with other things that I said earlier. I'll give them to Jenna. And
Sure.
maybe she can just underline them in the next draft, or, you know, so it'll be easy to pick up.
Okay.
Okay,
So then the second group are those who exhibit symptoms. And so if you're in the workplace, obviously you should leave. What to do if you're outside of work, not returning until they've been cleared by a physician or symptoms have resolved and they have tested negative. Employees and contractors subsequently test positive, then it goes into the isolation protocol, and administration should be notified. There is just a little caveat there that you test positive with no symptoms, the isolation begins on the day one of isolation day one. Hold on. Let me start over. You test positive, no symptoms present, began isolation day one, the day of positive viral test. So that's with no symptoms. And then if they further develop symptoms, they're in the 10-day isolation. Again, all of this at the beginning, and I don't know if it's worth putting it at the end, this is the protocol at the time of this plan and is subject to be modified in practice by the library director, given new information from public health officials. Sure, Barbara, you're muted though.
Sorry about that. There have been many known cases of a positive test on day one, and then they redo it the next day and it's negative. Can we somehow or other let them retest the next day or even later that day? Because these tests oftentimes, I shouldn't say oftentimes, but have been known to be incorrect.
So I actually don't know of incorrect diagnostic widespread invalid diagnostic PCR testing. I think what you're talking about is the home testing that can be accurate. And so what Marcia was suggesting earlier was to clarify what type of test we're talking about. Anybody who has a home test that tests positive should have it confirmed by a diagnostic test in an office. And I think those are typically where we're seeing the discrepancy in results.
yeah. Also, some of the rapid testing, I think it can be
Right,
false negative
right.
or positive.
And so by and far, though, I have not come across any guidance that suggests that someone can retest to exit quarantine after a positive test. And I'm not sure that the library wants to play in that space. But I will update it to your point, Barbara, to be specific about the type of test and recommend that, you know, if I don't know that we have to go into detail about if you do a home test, then you should go test at the office. I think we can just be clear and say that we're talking about, you know, office administered diagnostic tests.
Diagnostic testing, yeah.
Does that work for you, Barbara? Okay, sorry, I was just checking. Again, this is the only place in the plan where I think we go into such detail, but I think that there is it's like a choose your own adventure kind of thing. So to me, it's worth it to be explicit. And then the next section, by and far did not have a lot of changes. It's just talking about when they need to contact administration. And again, presuming that has to do with sort of the other implications of having a positive test and needing to be out that admin would need to know, one of which would be contact tracing. So at the bottom in this sort of concluding paragraph, I added a little language. So it now reads, we recognize there may be nuances or complexities associated with potential exposures, close contacts, symptomatic persons, and those testing positive. Local, regional, national conditions and policies may change. We will follow current CDC public health recommendations and requirements and coordinate with our local public health office for additional guidance and support as needed, was the additional comment.
So your earlier comment, should we replace local public health office throughout the document with Albany County Department of Health?
I'm open either way. They mean the same thing.
Okay.
So I'm fine with making it Albany County Health Department to make it consistent and
Maybe,
specific.
Actually, though, if you keep it as local public health office, I think you give me more flexibility because there have been times where the county is unreachable, but the town.
Sure.
Okay, so.
Yeah,
Yeah, I think local is a more encompassing
Mhm.
concept, and I think you should keep it local.
okay. All right, so that was a big meaty section. Any questions or concerns about staff exposure?
No.
Okay, so now,
good.
although I'm realizing, hold on. Oh, I know. So there was a whole section that detailed this section header was called staff exposures, cleaning and disinfection. I actually would like to amend that to just be staff exposures. In the safety plan and some other places, we talk about cleaning and disinfecting, but as far as I could see, all of the documents that were specific to businesses and cleaning protocols had been archived. And the general practices are just to have good cleaning protocols. I know that it was mentioned earlier at one of the prior meetings of sort of boxing the library in by detailing some elaborate thing. But if we're generally doing proper cleaning, and the other precautions that we're taking, there are actually no additional measures. So like all of the things that had to do with materials and all of that are no longer sort of common practice or recommended practice. So any questions or concerns about that? Again, I think it was really wisely put previously. It doesn't prevent the library from cleaning. And in fact, we know that the library has a high standard for ensuring the cleanliness. Cleaning does come in a little bit later in a more general and regular way. And I felt like that was sufficient, but I'm definitely open to discussion there.
In general, you're right. The focus on that sort of cleaning was when it was not as well known what the methods of transmission were, and everybody was worried to touch anything.
Right. Okay. So then the next part was the safety plan, which was required by New York State for any business or entity, on how the workplace will prevent the spread. So the people section, oops, hold on. I missed the spot. In general, in these sections, I had switched from to ensure to support language, because it was all about practices that the library was putting into place to support employee compliance, and just moving away a little bit from that hardline ensure language. So now it will read to support employee compliance. With physical distancing requirements, these are the things that the library will do. I know that in some places where vaccination is required, they relaxed some of these distancings, but I know that that's not a requirement at the library, so I left it in. Any questions or concerns about the people section?
Second bullet, we use the word individual. The is the employees, right?
Yes, all of the safety plan is from an employee workplace perspective.
Yeah, so we talk about employees in this section. We use the term individual in the second bullet. Do we mean anyone, or do we mean employees only? What this section refers to.
That's a good question.
Ensure that tightly confined spaces will be occupied by only one individual at a time, but this section applies really to the employees.
Except for
So,
that spaces
I
could
don't want to
be
nitpick
mixed
it, I'm
use.
just trying to understand it, yeah.
Yeah, I took it to mean that like any space that might be tightly confined. I'm assuming that at least one of those individuals would be an employee. So like I could see a scenario where an employee might end up in a space with a patron. And then in that regards, individuals more appropriate than employee.
I agree. I just wanted to, just so that we all understand it in a common way, yeah.
Sure.
I was thinking the same thing. Even though this section applies to employees, you could have exactly the situation you said, namely an employee with a patron.
Yeah.
So that's why I like the individual, because it's more expansive, but I
Sure.
just wanted to make sure everybody had the same understanding.
Sure. Barbara, did you have a question?
Yeah, just a quick one. Right now, are the guidelines for 3 feet as they are in schools? I think that's the general guideline, that if you're within 3 feet of individuals versus.
So actually that 3 feet was only advised or implemented formally for K-12. And I did not see it applied to any other settings, including higher ed. So it's a really interesting sort of thing. You would think that it would have trickled down, but it was only ever formally put out there for K-12.
The reason for that was that the research that they've, had so far over the course of the last 2 years is that, it takes an intense, they say within 15 minutes of very close contact to transmit the virus. So, as they learn more, I don't think, we should be putting in a 6 foot or a 3 foot that it could be in time, a 0. So.
Well,
that's a thought.
can I just add that the CDC still does say 6 feet in some of its documentation.
I can add a similar paragraph to the end of this that again allows Tim to update the operations of the library consistent with changes at the CDC. I mean, I think that we said it pretty clearly at the beginning, but it probably doesn't
Yep.
hurt to continue to sort of put that at the end of each of these sections. So if there ever were a time when social distance was adjusted, then it would automatically be in the place. Does that work?
No.
Okay.
That's cumbersome. That's really cumbersome. If you're going to put them at the end of each section, I think if you just have an
the
overall
statement at the
statement
beginning is enough?
at the beginning and say it applies to this plan.
Okay, great.
Yep.
So
Why do we
understood.
have to,
If the
encumber
distancing
this with-
changes, Tim, it's all you. You can adjust
Yeah.
it to the recommendation.
Okay.
One change that I'm seeing right now, just at the end of that section where it says in cases where 6 feet distance between individuals is not possible, we will ensure employee safety by providing the appropriate PPE. Actually, I'll just leave it as PPE. That includes masks, but I just was thinking like we're no longer giving people gloves and things like that.
Mhm.
Previously, we talked about moving the general guidelines for non-staff to the end. Upon sort of reviewing this again, I think that it does actually belong within the safety plan, so I did not remove it. And again, we are requesting patrons, visitors, vendors consultants, visitors, library practice the following recommendations provided by CDC and prevention to prevent the transmission of COVID-19 and other viruses. And so again, really general stuff, wash your hands, wear your mask, don't come if you're sick.
Just a point of information, the first one, everyone has to wear a mask, even children, babies, right?
We did change that in an earlier version. I'm sorry that I was working from one that didn't include it. Wear appropriate masking when coming to the library. Okay to say no exceptions for patrons older than 2 years old or 2 years old and up, 2+ years, or
Yeah, I mean,
individuals.
something like that, yeah. I mean, I don't mind the no exceptions, but I think the requirement is children under 2 don't need to wear a mask, right?
Sure, unless you interpret appropriate masking as those
Yeah.
guidelines. Do you want me to call out the 2 and up?
You know what? I would just leave it.
Okay. Because
I
honestly,
just-
it's appropriate masking doesn't apply to children under 2.
Right.
I can't read the faces right now. We're comfortable with that? Leave it?
Yeah, I am.
That's fine.
So protective equipment to support employee compliance. Again, we have that language. I took out really like the gloves. Limit the sharing of objects and discourage touching of shared surfaces. Or when in contact with shared object or frequently touched areas, sanitize or wash hands before and after contact. There's a little eye hanging out there. I simplified this. I think there were some other disinfecting protocols, but we now know that really just good old-fashioned adequate hand washing, in addition to the cleaning that we'll talk about here in a minute. To support employee compliance with hygiene and cleaning requirements. Again, this is a little bit, it's reduced, but provide and maintain hand hygiene stations, basically. Signage in the bathroom, you know, reminding people how to properly wash their hands. And then at a very basic level, conduct regular cleaning and disinfection of shared objects and surfaces. High traffic areas, restrooms, cleaning schedules will be maintained and kept on file. There was a lot more in there about like weird disinfecting practices. Of course, you guys can disinfect so your heart's content, but I think having as part of the plan a regular cleaning sort of schedule is sufficient. Okay with that update?
I am.
Yeah. We took out the log requirements, right?
Yes. Yeah, that didn't apply, actually. I don't think it ever applied to those employees.
Right. You might want to take out Swan's name. You might want to take, we have a particularly named head of a department.
Oh, yes, I did that throughout in the succession plan. Later,
Right.
I removed individuals, so I missed this one. Kept on file with head of maintenance.
I mean, I don't want him to leave, but you know.
Communication to support the business and its employees' compliance with communication requirements. Gilder One Public Library will post signage throughout the site to remind and update personnel regarding current hygiene, social distancing rules, appropriate use of PPE and cleaning. So small change there. I think the signage is also meant to not only remind them, but update them as things change. So again, with that discretion, we're giving the library director also a responsibility to keep people informed about what those are.
Under communications, Vanessa, the third bullet, is the last sentence redundant?
It might be. Hold on.
I'll have to call you. Okay. Don't we already say it?
The worker test positive order. Yep.
So I don't think you need that last sentence, right?
I agree.
Okay.
Okay. we're almost through this part and then we can focus on the table. I think we're in good shape. We have about 15 minutes left, so I'll try to pick up the pace. To support up-to-date knowledge of guidance that's being issued by the state and public health officials, the Gelderland Library will consult the New York Forward website. So that's basically the COVID website, the executive order website, and then regularly review available and applicable CDC, and I'm going to change it to local health department guidance. And we can throw in the links to those. Documentation of work hours and location stayed the same. This allows the team to do the contact tracing by knowing which employees were actually scheduled and present in the building. The administration succession plan, only change here was I removed the actual names of individuals that had previously been included. State of emergency policy. I think that just is what it is, right? If the government was to declare a state of emergency, and that's sort of how we landed with this plan in the first place. It acknowledges impacts to policies and services.
You took out all of the screening, yes?
Yes, because it was my
Okay.
understanding that it is
Yep.
no longer being done and it's not required. We also had earlierly stated, don't come to work if you're sick. So
I'm fine with that. I just wanted to make sure that I understood that.
all right, so then the last one is just, I renamed this to be specific because it was specific to COVID-19. So it's now the COVID-19 pandemic continuation of service. The categories were defined by transmission levels of COVID-19. So it didn't make sense to pretend like it was a chart for any other circumstance than COVID-19. The only question I had here is this calls for a meeting between the library director and the appropriate emergency committee
Yeah.
to move between phases. And I didn't really understand where the genesis of that was or the reasoning. So I wanted to leave it to discuss. I don't know with such clear criteria. I think it would maybe just be a notification. I don't know that we need to meet in order to move between phases. Thoughts on that? You're muted, Tim.
I would tend to agree. There was an earlier version of the plan, and I don't know if this is still in here, but there was an earlier version of the plan which required to move between phases that you had to go a week or two at, like currently the transmission level is high. And I think we had to move to substantial, we had to be insubstantial for 2 weeks before we could move to it. Whereas if we were in, let's say, moderate, and the numbers began moving to substantial, that was a 1 week requirement. So in other words, to take away 1 day fluctuations. And I don't know if that's in this version anymore.
No, I don't see it. And I do recall that.
No.
And I actually think with the sort of increased deference to you, that maybe that we don't need it to be that explicit, but we understand that you're not gonna switch it day to day.
Yeah, I don't want to go back and forth between high and substantial on a daily basis. So I
Right.
think I might use 1 week as a guideline if that works for everyone.
Sure. Do you want to suggest a sentence that we include in there? I'm just going to remove the prior.
Sure. How about the library director has the responsibility to move the library between the 4 phases anytime that the transmission rate
How about this? You don't have to do it on the fly right now.
Okay.
Just if you could revise that
Sure,
preamble.
I'll send you an email.
Yeah. We're getting rid of this emergency committee that doesn't exist.
Yeah. I don't know
Yeah.
what that was. I was actually,
I
I prior to moving between phases is a pretty long sentence, and then it describes the meeting that we're no longer having. So it really leaves that paragraph with the first sentence and then whatever Tim comes up with.
Fine.
All right. So we have 10 minutes to look through this really beautiful table. Maria or Phil, do either of you want to talk us through it? I think it looks great.
Well, essentially, the chart was, we're trying to be as clear about permitted and suspended. It was confusing. I think the chart that we had previously had some confusion and also even included some terminology that I think was Albany Public related and not really ours. So Phil and I, and then also with Beth Rienti, the head of youth services, worked on all of the kinds of services that we know we provide and what made sense under each category. And as you'll see, there is this asterisk that has been added to a few of the, well, no, not, I should say, actually, the asterisk appears to be missing from the version I'm looking at. There should be some asterisks next to, oh no, there they are.
Yeah, I see them.
Yeah, so for instance, let's look under high. Limited.
Tim, I'm sorry if I didn't know if you saw the chat. Can you also send the table to I think Mike and Barb and
I did not see it, but thank you. Yep, I'll do that right now.
So under high, you'll see that we've added a bullet that says limited seated computer use. And it has an asterisk next to it that refers down to the bottom of the chart that says denotes service is discretionary by the library director or supervising librarian. And we felt that this was important so that we didn't put some very restrictive number on some of these categories, which made no sense to us, but rather gave us the ability to be able to say, for instance, right now, in the high category, that we would like to have perhaps 2, maybe 3 computer stations set up for patrons to use. But this gives us the latitude to decide, all of the sort of background decisions that we have to make from the public service point of view of how long somebody would, be able to use the computer, where the computers are going to be placed. It simply gives us the ability to say that we'd like to have some limited seated computer use. Let us make those decisions about how many and where. The same goes with the categories for like courtesy seating. We put out more seating after our last meeting. I'm not sure if any of the board members have come in, but we put out substantially more seating. Under substantial, indoor-outdoor programs has an asterisk next to it. Again, that gives us, the people who actually run the programs, the discretion to decide how many people would be attending and what the particulars would be about where it would be held, that kind of thing. So it's just, I think, really trying to identify, all of the services that we currently are actually offering or intending to offer as soon as possible. And, those that have to remain suspended for a particular, for this high transmission period. So I hope the greater detail is makes it a little bit more understandable.
I completely agree. And I liked that we included our spaces. So it's really kind of hopeful to look at the substantial column and imagine, hopefully soon, when we could encounter some limited meadow playroom use, right, at the
Right.
discretion of the library. And so I think this makes it really clear, more clear, how as we move down to lower transmission rates, we see more of the things, services that are being offered available and additional ones. I thought that that was really, really nice.
Yeah.
In addition, the single person study room use
Right.
is a nice addition. And again, what's interesting to hear you talk about this, the indoor outdoor programs. I think that what we might have lost sight of for a little bit was that those have always been at your discretion of
Yeah.
the style and type and size. And so we have no reason to believe now that that discretion won't remain exemplary as it always has been. And so it seems appropriate to me. So
Well, I have to go on to a call with a physician, so I apologize, but just one question. Why were the handicap stalls left out of low and moderate?
I think it just means that in lower moderate, it's just the full bathroom. And then at substantial and high, there was concern about multiple people in the bathroom. So it was either the single use bathroom or just like one in the multi-stall. So we can work on phrasing that differently if that's unclear, but it's meant to provide more single use spaces.
All right, I'm sorry. I'll call Jenna with my just minor things, and I have to leave. I'm really sorry.
That's okay. Thanks so much,
Okay.
Marcia. I'm
Okay,
gonna
bye.
have to wrap in a couple of moments here too. Were there any other questions or concerns about the table?
I have two quick questions, and one is just the building head count. We have just right now it just says yes. Are we staying with the 100 that we're currently using, or is that going to be specified in the chart somewhere, or what's the intention here?
So what I would like to recommend, actually, and thanks for bringing that up, Mike, I noticed that, was that maybe we include the 100 under high. And then we can put the asterisks next to the yes and substantial and moderate. When we first did the head count, I would assume that the 100 is the most restrictive, right? Like we're not going to go down from that. We'd only go up. And so I think that this is indicating that there's probably some sort of restriction in there. I'm okay as long as we're restricted to 100 when we're at the high level. Unless we want to enumerate it further, I'm okay with letting sort of Tim put that in. I think that there's some benefits to putting the number in, but I also think there's some benefits to leaving it flexible. It could mean that by the time we got to substantial, there isn't one, or it's much higher. Like, I don't know.
That seems perfectly reasonable to me. I just wanted to clarify that. I have no problem with leaving that as discretionary.
Okay, so we'll put an asterisk by the two yeses under moderate and substantial, and including 100 for the high.
The only other comment I had, and this is just the one thing that I'm not particularly happy about, is the restriction on the multi-person restrooms in the substantial and high level, which seems like a step back from what the board had discussed and voted on a couple months ago. And my only question is, is there any reason to believe that the restroom is a particularly dangerous or high risk area? I mean, it's not an area where people congregate in large numbers. So just the fact that there's two stalls, or I mean, a couple stalls, there
Sure.
would be two
So
or three
Mike, at a prior meeting, we read there's some research about toilet plume or something like that. Did I get the term right? That
Yes.
can expose you to virus aerosol in the air with toilet flushing. And so
Can I ask, is that specifically related to COVID? Because my understanding, and this may be outdated, so it might be wrong, but my understanding, at least earlier in the COVID, was that they were saying that that was not, they call it the oral fecal route, and that was not a substantial or a high risk method of transmission for COVID. That it is for other viruses, but not necessarily for
Well,
COVID.
we can double check on it. I
Okay.
do know that a lot of municipalities are using wastewater testing. So if you can test wastewater for the virus, logically, I'm thinking that it's in there, but we can double check.
All right.
I'm also okay to just leaving restrooms as at the discretion of the library.
I'm fine with that as well.
And it is, you know, both of you have reasonable points of view there. It's kind of moot, as is the number of the head count in the building, because people are kind of self-limiting, you know, like the highest head count I've seen since September 28th is 38. So I was glad when you guys just decided to just leave it as a flexibility for the substantial and moderate level, because people aren't probably going to come in more than 100 then, you know.
You know
There
what?
have been,
How
there
about
have been a
this?
few times where we've had more than 38, but
There, okay.
yeah.
How about this? How about we remove restrooms in general? I mean, are restrooms really a service? And is there concern about just letting you all sort of, I don't know, it could be easily accomplished with signage.
I'm okay with that. We have signage on there now that says, in order to limit the potential spread of COVID, please use, you know, I can't remember the exact words, but please try to use the single-use restrooms located throughout the building, and then there's a map of them. But the concern that started, I don't know if Mike and Barbara were attending several meetings ago, the doors are so heavy to the single-use restrooms that it might be hard for someone with a walker or a wheelchair to get into them. And we're working on making some adjustments to it. But and you know, without going into gross detail, there are certainly public library patrons who sit in restrooms for a long time, and then you can get you know, the potential of more than 15 minutes exposure to somebody if you've got two of those patrons in the multi-use restroom. It's more of a problem at a place, at a larger, more urban library, but people do hang out in there, take baths, you know. None of this is happening here right now, but we're trying to keep it from happening. Is kind of where we're coming from.
Sure. Maria, did you want to hop in really quick? I really have to get going, but you look like you wanted to chime in on this one.
No, I just think that I would actually prefer to keep it in if possible, just because it's a good fallback for the staff to be able to have like, oh, it's written here as described. So
Good point.
Do you want to put a asterisk
yeah, sure, that's
on
fine.
it? Okay. And then that leaves you the ability to be a little bit more flexible with that if a need arose. Barbara, did you have a last comment?
Just a quickie, in light of what Tim said, I do want to leave it in so that people know that there are restrooms, you know, available to them.
Okay.
In the event of an individual, as Tim described, that can't get into one of these heavy doors, you know, we have to have the flexibility to let them use the, you know, the multi-stalled bathroom as well, if that's easier access.
Sure.
Yep.
All right, we did it. It's 1:05. Excellent work. I feel really excited about where this plan is. So I will send sort of the marked up version of this evening to Tim and Jenna so that we can get it sort of formatted and all put into one document. Then we'll circulate it to this group for any final sort of flags for typos or edits. Did I miss anything else on this? Feeling good about it?
That's great.
Great job.
Vanessa.
Really
Thank you.
appreciate the work on the chart. I think that one's probably the most consequential in what folks are interested in. So thank you again, Phil and Maria, for taking the lead on that. I appreciate it.
Is the plan to provide a fully like a red line version, you know, track change version for when this is presented to the board eventually?
No, actually, my idea was just to present it as a revised plan. I think they'll have it in enough time to review, and everybody has the other examples. I don't have the time to do
Okay.
a red line, and unfortunately, just sort of the history of how the document evolved, I had to take a PDF and convert it to a Word document in order to work on it, to get back to the original state. I don't have the legacy documents to do something like that. So unfortunately, I'm not able to commit to doing that. But on a positive note, we'll have a clean, sort of completely reviewed version to propose to the board. And they're free to make comments or suggestions on that, but. Thanks, everybody.
Thank
Thanks,
you.
Vanessa.